We do research, we do capacity building, and also advocacy work. Everything around the interests of improving equity, especially for rural indigenous population, and improving the overall democracy process in public policies. The challenges to access that we're facing have to do with discrimination of rural indigenous population. This discrimination affects not only the attendance of healthcare facilities, but also the allocation of resources for healthcare services that are benefiting those populations. These are not issues related to technicalities, but have to do with power relationship in our country. Historical situation of social exclusion that results in discrimination of families while they seek for healthcare. In terms of the solution to this access problem, we are working in terms of capacity building of community-based organizations so they can learn and understand that through existing legal framework in Guatemala, they are entitled as any other citizen to receive the health care that they need. We train them and we create capacity so they can understand and be aware of the framework, but also to demand respectful services and to demand services that correspond to their expectations and needs. Also, part of our approach with communities is that in terms of creating the capacity, they have to mobilize themselves to claim the rights, the right to health, which are very much clear in the political constitution in Guatemala. It's only a matter of challenging power relationship that exclude indigenous population groups. So it is very important in our approach that we mobilize population and we support communities so they mobilize to claim for those rights. In terms of the message that I can take home, it's that it is important that whenever we see issues in terms of access, a population facing problems with access, we should think and should be aware that sometimes have to do with technicalities, but also other times have to do with issues of exclusion, social exclusion, and some population groups that may be facing discrimination, historic discrimination. So we must be aware that this type of problems also do occur in those populations.